Welcome, everyone, and thank you for participating in the GTMRX Call for Member Feedback event. My name is Katie Capps. I'm the Executive Director and co-founder of the Get the Medications Right Institute. We're delighted that you've joined us today. I want to start by congratulating GTMRX on an important milestone. In 18 months, the Institute has grown to a robust membership base of 1,140 members, representing over 735 companies. That membership has been invited to offer feedback as part of our 4-part member feedback series. In total, we have had over 450 people register for the events. Each of these events will highlight steps to be taken for medication management reform in areas such as how we use diagnostics, how we integrate technology, how we pay, how we practice. In July, we released the Blueprint for Change. It's a robust report based on multi-stakeholder input and guidance for how to change the way medications are managed. It's our roadmap for reform. If you've not read it, you can find it in the Resource Center on our website. I'd like to take a moment to thank the GTMRX Board of Directors. They offer strategic direction and support and serve as board sponsors for our work groups. I'd also like to thank the GTMRX executive members and our strategic partners who support our work through leadership and funding. And finally, I'd like to thank the GTMRX staff. They do tremendous work. We are a small but mighty team, and they work very hard. So let me give you some troubleshooting guidance and some housekeeping information for today's event. If you have any technical problems during the event today, you should contact Natalie Cromwell. Her contact information is listed here. All participants will remain muted throughout the event. So to ask a question, use the chat box you'll find on the screen. General questions should be directed to everyone, and I will ask them during the Q&A period. As the moderator, I will also ask you, the audience, questions. And when you respond back to those questions, please respond back in the chat box under everyone, but note your response as response to Q1 or Q2. Now, how we integrate technology is vital for regulators, care providers, and payers. And it's important that they work together to establish standards and best practices for interoperability in order to make sure that clinical data is available at the point of care to enable the CMM process. With risk stratification tools, new data can be aggregated and integrated to identify those who need CMM services, supporting the medication expert in identifying patients that have not achieved clinical goals of therapy. Our Health IT to support optimized medication use work group has been hard at work, creating guidance and tools to expand access and adoption of these technology solutions to inform CMM and practice. I want to thank them for their hard work, and I would want to thank the work group for their participation. Presenting today on behalf of the HIT to support optimized medication use work group is Molly Ekstrand. She's a GTMRX Distinguished Fellow, and she will give you brief updates on the work group activities, and then I'll facilitate a member feedback session as a result of the discussion. Molly, I'll turn it over to you.
Great. Thanks, Katie, for the background and for the introduction. I'm really excited to share with you all today the work that we've been up to for the past 6 months. So here's a quick overview of our work group. We did have almost complete turnover in this scope of work for this past 6 months, but we had an amazing group to work with, very engaged people, experts from the technical realm of health IT, as well as great representation from care delivery and people involved in boots on the ground CMM practice. I'd like to thank them all for their work. Go ahead to the next slide. So over the past 6 months, we've really identified different facets of health IT that would help us become more efficient and effective to help provide the best CMM services out there. We gathered actionable health IT opportunities across different practice settings and different maturity levels that are out there. We uncovered a lot of lessons learned and success factors, recommendations and best practices for health IT, and what we identified as 4 different key areas. And then we shared examples and available tools to identify different people that would be our target audiences needing CMM level of care, and simplified a patient population risk stratification process. So insights that we've gained, we had a couple of speakers come and teach us about some of the technicalities around health IT, as well as some care providers come and speak to us about how they're using health IT in their practices. So really, should be no surprise to anyone out there listening, but health IT is really a cavern, and lots of different tools that we can use, as well as different standards and nomenclature that we can use to incorporate health IT into our practices. There are many tools out there to optimize medication use, but what we really did with this work group is focus in on the CMM practice model and CMM level care. So what we really took away from that is we can't wait for dedicated health IT resources. We know that in many organizations, health IT resources are very slim, difficult to get, and for sometimes with the CMM care process, we're not high on the priority list. And we can't wait for policy changes in legislation. The ONC interoperability is going to be great and probably transformational to this process, but we can't wait for that to happen. Go ahead to the next slide. So we did have a few opportunities to disseminate some of these concepts and get some feedback. So on August 19th, we had a blog, and the links to those should be popping up here in the chat box as well. So there are there's the blog on August 19th that really talks about how to just get started with your incorporating health IT and working with what you have to start to get that to work. And then we have a webinar on August 26th where I had the opportunity to present with Jane Gilbert, who's a colleague working in the teachers union in Kentucky. And we talked about how we integrated technology focused on a population health and risk stratification and identification of patients who could benefit from CMM level care. And then we had an article Katie and I co-authored in Pharmacy Practice News that was an opinion piece about how these different formative 4 pillars can really help improve medication management. Go to the next slide. So the tool that we developed with our work this past 6 months was we came up with the formative 4 pillars, and that should have been, you would have all received that if you had registered for today's webinar. So really interested to get feedback on that. But what we identified, the goal of this tool is really to identify multiple end users that could be interested in getting more information about health IT and how to incorporate and leverage health IT in their practices. We really recognized health IT as a maturity journey, that different organizations are along different continuums. And so what we really wanted to do is, rather than highlight one specific organization who's using, kind of the pinnacle of health IT integration, we wanted to find numerous examples across different practice settings, some of them integrated, some of them not, some of them being solutions providers, to give organizations just an idea of different ways that they can use health IT in their organization. Again, looking at different practice settings that are out there, and really kept it at a high level. We wanted to provide some really quick, tangible examples for how organizations can begin to work with what they have in their organization, as well as maybe some food for thought on, if they do have resources that can be dedicated health IT resources, that how they could take that to the next level. So the tools Yep. So that's okay. Go ahead. So the different personas, the people that we identify that would be our key kind of target audience for this group, looking at the clinical pharmacists that are involved in CMM level services, prescribers wishing to partner with pharmacists providing CMM, which seemed like the obvious group, but also looking at operation leaders in a health system that might be looking to start CMM services in their practice. We also thought about value-based networks that might be interested in providing CMM services to their population, so they could get a feel for how health IT could be incorporated across different resources that they might be using to provide CMM level care. There might be CMM program managers or pharmacy directors in a health system that are looking to evolve their current pharmacy services into a CMM level care, or simply enhance their CMM program by leveraging more technology. Additionally, care center organizations that might be looking to provide or improve their CMM level services and reach different customer populations. Go ahead. So the 4 different pillars that we identified that were really key to helping leverage CMM level care, we had clinical decision support tools. And if you think about either being a pharmacist or being a prescriber, when you sit in a room or by telehealth nowadays, when you're helping work with a patient, direct patient care face-to-face, what type of information is that pharmacist going to need right in front of them, or that prescriber or care team member, to help them make sound clinical decisions regarding a patient's individual medication therapy? And then the second pillar is really looking at the population health and risk stratification approach. So in my previous experience, we thought we did not want to put the onus on the pharmacist providing CMM level care or the different care team or prescriber to help them, or to make them think through, is a patient going to benefit from CMM level care or not? But what can we put in place from a system level to help identify patients who might benefit from CMM services, and then help to risk stratify populations, because we know that our healthcare resources are finite. Go to the next one. The third pillar is the patient engagement and care coordination. So when a patient is, if you could hide the poll for just a moment. Thank you. So we have patient engagement and care coordination. So how can Health IT facilitate that bi-directional and coordinated data exchange and sharing across the entire care team? And how does that include the patient? So recognizing that oftentimes the pharmacist might not be embedded in that same health system where the prescriber is located. And so how can Health IT facilitate that exchange of information to make sure that the care team is there to support the patient as a whole person? Also recognizing that patients have digitals and wearables that they are using, and that we want to give them an avenue to provide input and information as it relates to health data that might inform decisions regarding their medications. And then the last pillar is really looking at outcomes, because we know that when a pharmacist or when you have a CMM program in your organization, we need data that's going to help promote the clinical and economic and humanistic outcomes of what a CMM level program can do. So how can we link the pharmacist's activities or the care team activities around CMM with the total cost of care and healthcare utilization for high cost services? We need those objective markers of medication therapy, whether it's the patient's blood pressure control or maybe their diabetes A1C. And then also, how do we incorporate those patient reported outcome measures? So go ahead and cue the poll. So we really wanted to ask the group here on the call today, of those 4 different pillars that I just described, can you choose one of those that's the most challenging for your organization? And that might help us look at opportunities as we go forward. If we could just have your input to help discern which one might be most important for us to focus on. So please go ahead, we'll take a few a few more seconds and just ask you to choose one that might be the most challenging for your organization. I think we can probably close the poll. All right, thank you for the feedback, everyone. So it looks like those outcomes are the most challenging for your organizations. Great information and feedback. I appreciate that. All right, we'll go ahead to the next slide. So our Health IT work group is really looking at what are the different opportunities as we move forward. So we're viewing that formative pillars tool as really a foundational document. It is not all exhaustive. I know that there are many, many organizations out there that are also doing amazing things. With the volunteer capacity of our group, we did what we can to assemble some great examples that we hope that you'll find useful. But it is not an exhaustive tool. It's really a foundational document designed to give you food for thought and help kind of spur that innovative thinking within your organization and your group. So as we look forward and what we might want to pursue moving forward, and here's where I would love your input. So really looking at, do we do a digital timeline? Maybe we could hide the poll for a second here. So do we look at, thank you, doing a digital timeline of sort of an infographic on the Health IT enabled activity, and where we would choose one of those pillars, perhaps the outcomes one that you just shared, to really talk about how you could evolve that journey? Do we look on expanding? So within that pillars tool that we developed, there's short sections on overcoming the Health IT barriers. And do we do expand on those and create solutions that might be helpful for you? Do we outline characteristics of an ideal Health IT enabled infrastructure? And then one thing that we developed during the previous scope of work was a CMM practice management Health IT checklist. So a leader in an organization could take this document and say, hey, here's what we really need to think about in terms of having all the practice management aspects in place to make CMM practice successful. I'll let the poll pop up. So here's an opportunity for you to provide feedback on which additional tools that can help guide our work for this next scope of work that we work on. I think we can probably close the poll. Great, thank you for your input. And I would welcome anything in the chat box if you have additional suggestions that aren't listed here on our brainstorming session that our group had. And Katie, I'll turn it back over to you.
Thank you, Molly. And again, I want to thank the leadership of this group. We have Tom Wilson, who was Molly's previous co-lead, and Scott Robertson on the phone. Scott is the principal technology consultant with Kaiser Permanente. So Molly and Scott are now leading this group. So before I get into the questions, I do want to mention to those of you on the call today, if you're interested in participating in this work group, please let a BTMRX staff member know that. We've got some terrific leadership and they're doing some terrific work. So let's move on to feedback and addressing key questions. You guys will see that for those of you on the line, we've listed 3 questions on the bottom. So we invite you to respond to these questions in the chat box. Just note Q1, Q2, or Q3 when you respond back. Before that, I'm gonna, while you were doing that, I'm gonna ask Molly and Tom a few questions. What are the from your standpoint, Molly, what are the key recommendations to improve technology within a CMM practice? I'll ask you that first, and then Tom is welcome to step in and add additional comments to that.
Thanks, Katie. I think one of the things that we did in our practice early on, when there were just 3 of us pharmacists and we were in our own practices and we did not have any health IT resources dedicated to us, is we figured out how to be, I'll just say, scrappy and nimble. There's a lot of different tools within the EMR, EHR that can help us look at medications a little bit differently. So from a pharmacist perspective and a pharmacist lens, we really looked at how can we create tools, and whether that was a smart phrase that would pre-populate a patient note that would help us look at medication specific data, or objective lab measures that would help us make medication related decisions and automatically pull that into our note. We found that very helpful. And we just started looking at what we had available to us. We could build notes, phrases based on what was already built, and we would rework it into a medication specific form. And then so I would just say, just get started.
Yeah, and Molly, you've mentioned that frequently, both in your writing and the blogs that you've done, and that end of it, and that is it's don't let the perfect be the enemy of the good. Get started and let the process mature as you move forward. And I think that's really good advice, particularly from the standpoint of implementation of a CMM level program. And given your experiencing developing CMM technology enabled programs, I think that's a really sage piece of advice. Tom, did you want to add anything to that, to what Molly mentioned?
Thanks, Katie. Just a couple, and I agree with all of those points. One or 2 things I would recommend to give some thought to, especially getting started, is the outcome strategy. If you think about how you're going to show the quality of care that you're providing, and how you can start to, track that in a system, I think up front makes things much easier as you grow. And then the last point that our group made, and I'll echo, is the data quality that you get. While claims has some stuff, and yes, we have some future improvements with interoperability, but really thinking about data quality and how can you get the data points that you need at the point of CMM to provide the best service possible.
Yeah, I think that's a very good point. So Molly, tell us more about the journey toward a mature HIT support system to optimize medication use. If you could tell us from a more of a pragmatic and program manager standpoint, and then Tom can tell us a little bit more from a technology standpoint. I think those would be really good insights for the listeners.
Sure. I will be the first to admit that I am not a health IT expert. I was a leader in a program and worked with what we had. I learned a lot from our health IT colleagues that eventually were dedicated or were able to dedicate some resources to us. Tom is a technical expert and has been so insightful, and I've learned so much from him through the process as well. Through the maturity journey, to Tom's point, there were a lot of opportunities for us to look at what start with the end in mind. What did we want to gather? What did we want to look at? And really looking at some of that from a pure quality improvement standpoint, or aligning our program with our quality measures that were important within our own health system, the clinical priorities and things that we were working on as a health system. So how can you start to gather some outcomes related to the priorities of your system? I think was very helpful to start with the end in mind.
Yeah, and to that point, Tom, you made that point earlier, start with the end in mind as it relates to outcome measures. And as you both saw, the number one response when we ask about the biggest HIT enabled challenge for our audience was, the outcomes, economic, clinical, and humanistic outcomes they found the most problematic or challenging. Tom, do you have recommendations or suggestions as it relates to that from a technology standpoint and how practitioners may approach that, particularly translating that need back to HIT people that may not be as approachable as you and Scott are?
Yeah, I think really communicating the need and also communicating, that the IT team doesn't have to invent something, that there is a lot of tools in the marketplace, and coming from a technology side as this service mindset, like figuring out AI tools or business intelligence tools that may be generic in nature, and how to integrate them in a custom solution to provide value for the CMM team is what I would recommend.
I think those are all good suggestions and recommendations. We have several questions from the audience related to research into some of the best IT vendor platforms and API integrations available in the market to help with the IT lift for comprehensive medication management and pharmacogenomics testing. We talked a lot about this on our member call yesterday, as a matter of fact, but do either of you have any insights or input into in what way there guidance that might exist in the market as it relates to that?
So I'll back up with the first question that was right above that in the chat box about getting the large EHR companies to standardize some elements. And without doing a plug for one particular EMR, we did, there was a group of us in Minnesota and across the country that provided some insights and input into Epic. And so I know that Epic is coming out with a medication management module that's part of their foundation system that does use things like SNOMED codes and standardization, really looking at the PQA and pharmacy health IT adopted elements. So we're excited about that. If you have Epic, apologies, I'm not familiar with what other EHRs might be doing in that area. To the other question that you just asked, Katie, I know that it's a challenge. It's a challenge for pharmacists that are not integrated into the same practice as the prescriber. And that's such a key component in that team-based care, is making sure that we can share data and help make sound clinical decisions together as it relates to a patient's medication therapy. That's a challenge. And I think that's something that we really want to try to overcome. As the work group, we tried to identify a great example of either a health information exchange or a great example of where there's a vendor that's able to connect with the care team, and not just with their pharmacy benefit manager or their MTM program within their company, but really how do we connect with that care team?
Yeah. And of course, both of you know our focus has been on health information technology that supports the team at the point of care, recognizing that pharmacist as the medication expert needs to absolutely be included on that access to that information. Tom, did you have any comments you wanted to offer in response to that question?
Just to echo some of the comments I see, again, to tackle that, while looking at particular EHRs, to really look at some standards like FHIR, which is done by HL7, and CDS hooks. When you're looking at vendors, make sure they're moving towards or have those standards in place, which will make interoperability much easier now and in the future.
Yeah, we have a question from the group as it relates to the priorities of this work group. How is the work group working with the standards organizations like HL7, NCP, DP, et cetera, to ensure data exchange can occur? Or is this group doing that? And the comment that there may be solutions already available that aren't being leveraged. Is this something that the work group might consider focusing on as the future tool or output from the work group? I think this is both a comment and a recommendation to Molly, Tom, and Scott. I don't know if you want to comment on that, but it's a
Yeah,
recommendation.
absolutely. And I think it's important to note, I see the comment in there about Shelley Spiro, and she was a speaker on one of our early or one of our work group sessions late this fall, actually, after we had already kind of put this scope of work together. So I would say that we are keenly interested in working with Shelley and the Health IT group to look at how can we leverage the pharmacist e-care plan to really promote a CMM level care process. And I think that might be an opportunity. Very excited.
And to your point, Molly, I think we have a comment that and a comment and a statement, couldn't agree more. The flow sheets are not notes, are more interoperable. We should also consider rethinking how we document as part of that. I don't know if either one of you want to make a comment as it relates to that, but I think that's a very good point. So I want to make sure that we capture everything. Any additional questions that have come up. What I would like to do now, Molly, is I'd like to offer you an opportunity and Tom an opportunity to, Molly, specifically you as it relates to the journey, and then Tom as it relates to interface with technology within either large organizations or small organizations. Molly, can you talk about your journey toward maturation and some of the key takeaways outside of just getting started, start from where you are and move forward? Are there any additional comments you'd like to make as it relates to your journey toward maturation in a large system? Because I think you've had incredible experience in a large system making it work.
I would really credit my additional training in the area of quality improvement and looking at what we want our practice to look like and how we want our practice to align with different quality improvement initiatives within the organization. That really helped me put a focus on what we want to gather in our notes, how we want to focus our efforts, how we want to focus on our different patient populations that we're working with. Look into quality improvement training.
Okay, thank you. Tom, how about you from a technology standpoint?
I would recommend, again, kind of keeping an eye on the science and training of your clinician providers to try to give them the most up-to-date, most knowledgeable information at their fingertips, and bringing that science in through technology makes that efficient. But pharmacogenomics is right up there with the need to provide medication safety to people. Having that skill in your house is critical.
Yeah, and Tom, thank you for that. It's a very good point. Yesterday, we held a member feedback session with the Pharmacogenomics Payment and Policy Solutions Task Force and the Precision Medicine Work Group, and there are forthcoming documents for both of them. One has a terrific use case out, a Medicare use case, and the other is an evidence document as it relates to CMM plus pharmacogenomics testing that I think can offer insight to some of the participants. Now, those of you that are on the line with us today that pre-registered for this event should have received the tool that Molly and Tom have been talking about. It was linked in your reminder emails or follow-up emails. For those of you that did not receive that or did not see that before jumping on this call, those tools will be publicly available at the end of November. The purpose of these feedback calls and the member feedback calls is to get comments and recommendations as we move forward, and to ensure that if there are enhancements that we may be able to make, we can make those before they're publicly released. So with that, I want to thank you, Molly and Tom and Scott, in your new leadership role, for your leadership and support of the work. I want to ask those of you on the line today, if you are interested in participating with the work group, please let us know. On behalf of the Get the Medications Right Institute, I want to invite all of you to give us feedback. After this event, you will receive a survey, and we do ask that you respond to that survey with additional comments or insights. Your insights are incredibly valuable to the Institute as we continue to move forward with our goal of making sure every patient gets the right medication at the right time and the right dose. Please fill out that survey so we can move forward in an informed way. I also invite you to visit the GTMRX website and download the latest report, Blueprint for Change, Calling for Medication Management Reform. Look for the new tools that have been discussed today and as part of the other work group meetings. And if you are interested, we have 2 additional work group calls that will occur next week. With that, thank you, Molly. Thank you, Tom. Thank you, Scott. And thank you for our participants on the call today.